Well, I'm a psychiatrist at Sage, and mainly do general adult psychiatry, and mainly do psychiatric assessments and medication management. The population of patients, includes, of course, people with significant depression, people with bipolar disorder, uh, people with psychotic problems, including schizophrenia or mood problems with psychosis, a lot of people with anxiety, patients with ADHD, patients with substance abuse, because so many people now have both a primary mental health and a substance abuse problem. There's so many people that really need help with their mental health and substance abuse issues, and it's been amplified by the virus situation. So I've found myself recently being more motivated to get up and be available and help people. From my perspective, what I like about Sage is I can get the services that patients need for them. At Sage, we do, of course, mental health care, which includes psychiatric care, medication management. There's therapists. There are groups, and the groups address important issues. How to deal with behavioral health problems, things like emotional regulation. And of course, there's a very strong substance abuse component. And again, so many people have problems both with a primary mental health issue and substance abuse. So they can get help at Sage. Also, Sage has the primary care department. I was working in Utah for a while, and there was an article in the one of the papers from Salt Lake, and it was about mental health stigma. And it was a poll about that. And 50% of people had, a positive view about mental health, and 50% of people thought that basically that was a personal responsibility, that somehow was also a personal weakness. So there was a 50-50 rating of people that had a pretty good view about mental health and people that had a stigma about health. And I went to my office then, and there were a number of people there, and I was kind of upset about this because 50-50, that's awful. And one of the psychologists in the office said, grabbed the paper, looked at it, and said, "Dr. Smith, this is good news because it used to be worse." So it's part of the popular, bigger view that a negative views about mental health, and that affects us all. That affects, because we take in the information from society. So I think individually, especially if one's in treatment, it's kind of important to examine one's own attitude and thoughts about mental health. People might be surprised to see that they may have a little of their own prejudice against mental health, even though having a mental health issue and being in treatment. Because treatment for many problems is effective. And you don't want to have your own barrier about stigma of mental health to prevent your own treatment.